Hello, and thank you so much for joining us for the Health Partners Speaker Training intended to provide guidance on the upcoming virtual Government of Canada Workplace Charitable campaign. First of all, thank you to everyone who could join us today. Thank you especially to those of you volunteering your time to speak on behalf of Health Partners and one of the 16 charities that we collaborate with. You are likely someone who lives with a chronic illness, you are a survivor, a caregiver, or you know someone who has suffered and you're here to share that person's legacy. Thank you for taking the time to share your story and to raise awareness about the incredible work your charity does. We want to acknowledge that it is not easy to be vulnerable and share your story in front of a group of people. So on behalf of Health Partners, thank you. So first of all, why are you here? You've been selected to provide your testimonial during the Government of Canada Workplace Charitable campaign. And as you may know, events this year will take place virtually. So we wanted to make sure that we have prepared you for this new style of campaign. To start with, a little bit about us. Health Partners' vision is a healthier Canada. Our goal is to reduce the incidence of chronic disease amongst Canadians by working with employers to support and help them improve the health of their employees in the workplace. We connect our 16 member charities to individuals in workplaces and promote health and well-being. Why do we want to improve the health and lives of Canadians? This year in particular has really anchored how precious life is and how important it is to look after our health. As you may know, statistics show that 87% of Canadians are affected by one or more of the diseases that our 16 partner charities represent. We all know someone who is diagnosed with, is living with, or has passed from a major illness or chronic disease. This is something that connects us all. Since 1988, Health Partners has raised over $178 million to directly help our 16 trusted charities focus on health issues which impact millions of Canadians every year. Health Partners is a unique collaboration of 16 of Canada's most respected health charities who all agreed that they could do more together than they could individually. This year drives home how much we are all in this together. Each of our partners does more than just offer programs and services in every community across the country. They invest in life-saving research that results in treatments, cures, and better prevention. When we talk about workplace charitable campaigns, in particular today, we are discussing the Government of Canada Workplace Charitable Campaign, otherwise known as the GCWCC. The GCWCC is a charitable giving option for federal public servants and federal retirees, and it's been in place since 1997. Through this campaign, government employees and retirees can support United Way's social service agencies, Health Partners' 16 health member charities, or any other registered Canadian charity of their choosing. The campaign takes place Canada-wide, coast to coast, from September to December. We've also included some private campaigns for your information. Health Partners participates year-round in private sector campaigns across Canada. Some of these include Bank of Canada, ABB, La Capitale, and the PEI government. Donations, as you know very well, really do make a difference. Since March of 2020, our member health charities have provided over 400 webinars that address chronic disease and COVID-19. These charities have had to pivot quickly from in-person services to virtual programming. So when we talk about donations, we talk about how they support medical research advances that save lives, how they understand the link between physical and mental well-being in the face of illness, and how they help provide programs and services both online and in person that enhance the quality of life of people living with a chronic disease. So that's a bit of background about Health Partners. I will now briefly review tips on how to create and deliver an effective testimonial. So the purpose of your testimonial, why is your role so critical? When you share your story, it creates a ripple effect and provides a meaningful way to connect with the audience. Your story is a way to communicate the impact of giving and what a difference one gift can make to people in the community. Your story is also a way to thank workplaces and employees for their continued support. We may not be able to have in-person events this year, but even virtually, a thank you can go a long way. Let's start to think about your actual testimonial. What should it include? In terms of content, we suggest you break your content down into key messages, your own personal journey, and within a 5 to 7 minute time frame. Please note, we do not choose this length of time. This is traditionally what we are given for Government of Canada workplace events. It does help to know this ahead of time, however, so you can create your testimonial within this amount of time. We know that when we speak about our own personal journeys, it's important to make it memorable and digestible. This helps ensure your connection with the audience. So this is not an easy task. How can we make things easier for you? People tend to remember things well in threes, so we suggest that you create your impact speech starting out with an introduction, supporting information, and finishing with a conclusion. In terms of an introduction, you could frame it like, "Good morning, my name is, and I am here on behalf of Health Partners and the name of your charity." Keep in mind that the more you say Health Partners and the name of your charity, the more this helps donors to anchor to the Health Partners section of the e-pledge form. Your first key message could look like, "Did you know as many as 87% of Canadians will likely be affected by one or more chronic diseases or major illnesses during their lifetime?" This key message underscores the number of Canadians who are affected by chronic illness and disease each year. Your second key message could be, "Health Partners' 16 health charities work tirelessly to find cures, treatments, and diagnostic tools for over 400 chronic diseases and illnesses that account for nearly 80% of all deaths in Canada." Adding a few well-placed and memorable statistics can really go a long way to connect with your audience and to help engage them. Your third key message could be, "Since 1988, Health Partners has raised over $178 million saving and improving the lives of millions of Canadians and their families in every community across the country." In terms of supporting information, this is where you get to tell your personal story. It could involve talking about your lifestyle before your diagnosis, the impact that the disease has had on you and your family, and how your charity supported you. In terms of lifestyle before your diagnosis, you could start by talking about your family life. Did you go camping? Did you coach your daughter's soccer team? Did you run your own business? Then you could describe how you learned that you had the illness. Where were you? Who told you? Was there something particular about that moment you remember vividly that you could share? You could finish this section with how you felt and how it felt sharing the diagnosis with your loved ones. These are just a few examples of what you could include in your story, but of course you know your journey and you will make it your own. In terms of impact, you could then move on to describe the impact the illness has had on your life and on your loved ones. For example, how the time away from work has impacted you, the cost of the medications, and the travel to and from appointments. You could also describe how you felt. You may have felt lost. You may have had many unanswered questions or the need for support. You may have felt sad, depressed, or angry. These are universal feelings we all feel and will connect your audience to you. Your style and comfort level when sharing this very personal information is up to you. Please only share what you're comfortable with. The next section, how your charity supported you. This is where you get to praise your charity and really showcase it. You could talk about the helpful information you received when you connected with your charity. You could talk about how it felt to feel supported and how it felt to provide information to your family as well. You could talk about how your life is now. How has it changed? How is it still the same? Your conclusion should leave the audience on a strong note and connected to your story. We suggest something like, I am so thankful for the support I receive from your charity and from health partners. Your generous support has helped me, my family, and so many others. Thank you. There are two really important reasons for a strong conclusion. As I mentioned earlier, it's essential that people remember your charity and health partners. This makes it easier for them to find your charity name on the e-pledge form when they go to make a donation. And of course, you can assume that this will not be the first or last testimonial that your audience listens to. Making sure you review charity names helps your audience remember you and your testimonial. Health Partners Accounts Managers are available to answer your questions and provide any support we can offer. You will find us across Canada. We are located in National Capital Region, British Columbia and Alberta, the Prairies, Saskatchewan and Manitoba, Ontario region, and the Atlantic region. And if you still need to reach out to us, we have an email address, info@healthpartners.ca, that will also help you. On behalf of Health Partners, we want to thank you again for being willing to volunteer and share your story. We could not do this without you.